Good afternoon, ladies and gentlemen. I'm Bill Roper, and it's my distinct privilege to welcome you to this very special occasion, the dedication of the North Carolina Cancer Hospital. We're here to say thank you, above all, to the people of North Carolina, but to a number of others who've had instrumental roles in the construction of this facility. 4 years ago, in September of 2005, many of us gathered near here for the groundbreaking of this marvelous facility. I think you'll all agree that its construction has been an incredible accomplishment and a true testament to the vision of our state's leadership. This is a big day for the people of North Carolina, for the state of North Carolina, for the University of North Carolina, for UNC Health Care, and I think it is a verifiable scientific fact that the sky is Carolina blue. Today we want to say thank you to Governor Purdue, to Senator Basnight, to Senator Rand, to Speaker Hackney, and to all of our legislators, many of whom are here today. We've recognized them and the generosity of the people of North Carolina with a bronze plaque in the hospital lobby. I'd also like to say thank you, and a very special personal thank you to Jeff Haupt, my distinguished predecessor as Dean of the School of Medicine and CEO of the UNC Health Care system. It was Jeff who conceived of the North Carolina Cancer Hospital and who launched the monumental effort that has brought us to today. Thank you, Jeff. And thank you, Chancellor Meeser, for your tireless leadership and perseverance on behalf of securing the funding for this hospital. We are grateful. And now it's my honor to introduce the President of the University of North Carolina, Erskine Bowles, a tireless friend and major supporter of the university and all its campuses, and in this case, the UNC Chapel Hill and the medical school and this new cancer hospital. Thank you, Erskine.
What a crowd. This is great. And it's the only time I get to wear this tie and not catch a bunch of junk. Thank you, Dean Roper. To say that I am thrilled, just like all of you are, to be here, to see this spectacular cancer center would be an understatement to say the least. What we will have here, thanks to these legislators and thanks to the people of North Carolina, is we will be able to make available to the citizens of this state in all 100 counties across the entire state the most innovative cancer treatments and the best doctors available anywhere in this country. You know, at a time when other states have been cutting back on the funds that they make available to high quality health care access, this governor and this General Assembly stood up for the people of North Carolina, and they reached out and made this marvelous investment. I want you to know today I am proud to be a North Carolinian. I am proud of the people who represent us, and I look forward to the great work that will be done by the doctors and the researchers here at this great facility. Thank you all so much for being here. Thank you for today.
And now it's my privilege to introduce the Governor of the state of North Carolina, the Honorable Bev Purdue. Governor, we deeply appreciate your many years-long support of this institution and what we're trying to do here. Your tireless and dedicated support for improving the health and wellness of the people of North Carolina is legendary. Thank you so much for being here today. Governor Bev Purdue.
Speaker Hackney and Senator Rand, I'm always honored to be in your presence. Erskine, you get better and better, and Holden did as well as he'd ever done. I thought I loved his story about the piano. I'm glad you're not running against me, Holden. I want you to know that. Walter Dalton, the Lieutenant Governor, I'm honored to be in the presence with you, and Y'all, you've got a real good friend here. Lanier Kanzler is the new Secretary of Health and Human Services. He's doing a fabulous job in really hard times. So this is a big day. How many of us have gone over to the other facility and thought, wow, our people deserve better than this? The research and the teaching was dynamic, even in a really outdated and antiquated facility, but we all wanted more for our people. And I have to say that I did just hang up from Senator Bassnight, and he has been a driving force in this building, and we all wish he were here with us today. Joe Hackney, we're delighted that the House and the Senate came together on this building and on this investment of the people's money. You know, we've come a long way in the last 3 or 4 years since the General Assembly set aside money to get this vision off the ground. There were some in North Carolina who said, it can't happen. There are others in North Carolina who said simply, as many of us are prone to do, just watch us make it happen. The Health and Wellness Trust Fund Commission that I chaired at the time came in with a share of ongoing money to help pay for some of the research that will go on in this marvelous teaching and research facility. And now today, all of us are seated here in an historical moment. We have the North Carolina Cancer Hospital. This is actually a 21st century home for the world's cutting-edge treatment and research and care for a disease that all of us know so well. You know, I tell folks, it's not if you get it, it's when you get it. This is something that touches every family in North Carolina. So how right and proper and important that the people of this state would invest in a hospital that treats the families of North Carolina. This hospital, working with the Cancer Research Fund, will change that care and touch lives in ways that you and I will never even be able to imagine. It's going to be all so sophisticated. So I welcome you once again to North Carolina's hospital, the new cancer hospital, which I still call the People's Hospital.